Thank you. As always, right around this time on Wednesdays, joined by Dr. Syed Hussain from Trinity Health in New England to talk about what is shaking in the medical world. First of all, good to see you again, Doctor.
Likewise. Thank
Sorry,
you.
just wanted to get right into it.
Sure.
It looks like the World Health Organization tried to streamline kind of the COVID vaccination recommendations. Talk a little bit about that. Looks like they're sort of maybe de-emphasizing it for people 17 and under.
Yeah, this is based on epidemiological data that the WHO has gathered across the world, and it basically divides people into three groups: high, medium, and low risk.
Yeah.
And high risk individuals, the WHO recommends should get a second booster shot if it's been more than 6 months since the first COVID-19 bivalent dose that they've received. And these are individuals above the age of 65, immunocompromised of all ages, frontline healthcare workers, pregnant individuals. Those are in the highest risk category. It's not surprising, Tim, that there's some sort of prioritization being done based on data that we've received, which indicates lower mortality, lower risk of severe disease in those that are younger and healthier.
Yeah.
But also, we need to go back to making sure that immunization schedules for children and others are on track, because they have taken a beating over the course of the pandemic.
Right. So that's something we're going to have to keep an eye on. And I think the World Health Organization said, again, based on epidemiological data now, things could change. We'll see. All right, moving on. We were talking about a study earlier this morning about how the number of mental health hospitalizations in children has really jumped up before the pandemic. This is 2009 to 2019. It's gone up by about 25%. And then even amongst those, the proportion that involved suicidal thoughts and self-harm, that proportion nearly doubled. What are we to make of this?
Yeah, this is very concerning. And to your point, this is data that was gathered before the pandemic started. We know, based on data from the pandemic, that mental health issues have gone up.
Yeah.
So what this means, Tim, is that we need to provide more resources for our children in schools, and community organizations need to step up so that we have those wraparound services to detect depression, for instance, and suicidal behavior, as you said earlier, did go up in this study as well, which is very concerning.
You mentioned wraparound services. What are those?
So help groups, for instance, those that can help individuals that may have signs of depression. Support groups that help in this age group would be a couple things that come to mind.
Okay, there you go. So yeah, something again to keep an eye on. Narcan. It looks like I guess the federal government is looking at approving Narcan to try to make it more widely available, but maybe that could run into some problems there. What's your take on that?
Yeah, I am looking forward to this, Tim. Remember, there's an opioid epidemic raging across this country with over 100,000 deaths annually over the last couple of years. So this will help tamp down the fatalities we see from opiate overdoses. However, a couple things need to be worked out, including pricing.
Yes.
Because most insurance companies do not pay for over-the-counter medication, as well as the stigma related to using Narcan. But again, I am looking forward to Narcan being available more readily. Yeah. We know from data from these opioid deaths that more than a little under 50% of those deaths have bystanders that are available at that time of that tragedy happening, which means that there could be some help provided.
Right, because before you would need a prescription to get Narcan, which seemed a little odd because, well, just need it right there, like an external defibrillator, and just have one of those readily available. I think the idea, though, is that you said pricing could be a problem. Now, all of a sudden, if pharmacists have to put it behind glass, then you get into the stigma. People have to go out of their way to ask for it. That might be something we need to be worked out. But still, step in the right direction?
It is, absolutely.
Very good. All right, thank you so much for your time, Dr. Hussain. Good to see you, like he is always here with us 8:30s on Wednesdays to talk about everything that's going on in medical news. So.